Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Oh, back so soon? I guess you just couldn't wait to hear what else is on the differential for chronic dyspnea. Well, wait no more, because...
That's right. It's time for restrictive lung disease, in which something restricts the lungs from fully inflating. Just think of this restricted seal caught in that just can't expand its lungs. Restrictive lung disease has many more flavors than obstructive lung disease, but regardless of the specific cause, the unifying signs common to all restrictive lung diseases are the classic PFT findings. In restrictive lung disease, the lungs are restricted from expanding fully, which means total lung capacity, represented by that total load capacity tank, and residual volume, represented by that residual fish tank, are both reduced. FEV1 and FVC are also decreased, but in contrast to obstructive lung disease, the reductions in these values are proportional. Thus, the FEV1 to FVC ratio in restrictive lung disease is usually normal or even elevated. The end result of these reduced lung volumes and flow rates produces a characteristic flow volume loop that's shaped much like a normal one, only much smaller in size. That's why this mound of sand is a lot shorter, but not scooped, compared to our obstructive lung disease sand pile. Let's do a lightning roundup of the major types of restrictive lung disease, starting with the biggie, interstitial lung disease. Interstitial lung disease actually refers to a heterogeneous group of disorders that are classified together because of similar clinical manifestations. In most cases of interstitial lung disease, inflammation of alveolar walls leads to fibroblast activation and collagen deposition, which ultimately results in irreversible fibrosis. Hence the fibrotic-looking lung coral down there. Pulmonary fibrosis distorts lung function and impairs gas exchange, which is why patients become dyspneic. The most common identifiable causes of interstitial lung disease are exposure to occupational or environmental agents such as silica, coal dust, or asbestos, and drug-induced pulmonary toxicity. So make sure to ask your patient for a detailed occupational and medication history. Despite the many different known causes of ILD, though, the most common cause overall is still idiopathic pulmonary fibrosis. Don't remember what IPF is? Head over to our interstitial lung diseases chapter for more details. On chest X-ray, the most common abnormality in interstitial lung disease is a reticular pattern of opacity, especially in the lung bases and periphery, kind of like this reticular net here, stuck way down at the bottom and far corner. Nodular or mixed reticulonodular opacity patterns can also be seen. Remember, though, that chest X-ray findings in ILD are not specific, so if you suspect ILD, your next step should be to order a high-resolution chest CT, represented by our recurring sketchy symbol, the black CT cat. Scuba-ing underwater. Now that's boldly going where no CT cat has gone before. As for why? Yeah, I got nothing for you.